Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome back to the fourth episode of this presentation about this book, Handbook of COVID-19 Prevention and Treatment, which is done by, audited by Professor Tingbo LIANG. Hopefully, I am pronouncing the name correctly. Thank you very much, Professor, for sharing, and thank you for your agreement that I can share it as a presentation. So now we'll talk about the fourth episode. I received this book on Wednesday, and I work day and night to prepare this PowerPoint. And it was also my friend Amin he support me, and I decided today to finish it today, Saturday, 21st of March, to finish it by today. All the episodes should be loaded in the YouTube. Hopefully, I can do this target. Thank you very much, and I hope also you can share with others. Happy Mother Day. Today is again 21st of March 2020. We should not forget our mothers. This is the book, the author of this book or the auditor. So I will go now to the part where we reach. So this is finish. So where we are now, so we supposed to reach to this last part of part one, because this book is consist actually of three parts. So this is the last part of this the last part of chapter of part one. Still there is two parts. We'll talk from next episode about it. Let us start. So we will talk today about three things. We will talk about procedure for taking remedial action against occupational exposure to COVID-19. We will talk also about surgical operation or for suspected or confirmed patient, what to do, how to do the surgery. So the surgeon should know. Procedure for handling if the patient die, what to do of suspected, and how to use the digital support for epidemic prevention and control. So again, this is from this book, Handbook of COVID-19 Prevention and Treatment. So in this chart will show you procedure for taking remedial action against occupational exposure to COVID-19. Occurrence of COVID-19 related exposure, occupational exposure. If we exposed to infected skin exposure, damaged skin exposure, what to do? So remove the contaminant with clean tissue or gauze, then apply 0.5 ml iodo-4 or 0.75 or 75% alcohol to the skin, and let the solution sit for at least 3 minutes for disinfection. Thoroughly flush with running water. What about if you exposure of mucous membrane such as the eye? Flush with plenty of normal saline, 0.05% iodo-4 for disinfection. Sharp objective injury, squeeze blood out from proximal end to distal end, flush the wound with running water, disinfect with 75 alcohol or 0.5% iodo-4. Direct exposure of respiratory tract, immediately leave the isolation area, gargle with plenty of normal saline or 0.05% iodo-4, dip a cotton swab into 75% alcohol and wipe in a circular motion the nasal cavity gently. Evacuate from the then all of this you need to evacuate from the isolation area and enter the designed isolation room. Report to relevant department. Isolation and observe people with exposure other than infected skin exposure for 14 days. In case of symptom, report to the relevant department in a timely manner. Of course, the availability of product also depends. If you don't have this product, just I'm telling you their story, what they are doing. So it's you can look for any other way to do that. Procedure of taking remedial again, continuing. So skin exposure, the skin is directly contaminated by large amount of visible bodily fluid, blood, secretion, or fecal matter from the patient. Mucous membrane exposure, mucous membranes such as the eye and respiratory tract are directly contaminated by visible bodily fluid, blood, secretion, or fecal matter from the patient. Sharp object injury, piercing of the body by sharp objects that were directly exposed to the patient's bodily fluid, blood secretion, or fecal matter. Direct exposure of respiratory tract, falling of the mask, exposure the mouth or nose confirmed patient 1 meter away who is not wearing mask. So this is just explanation of something in this table. What they mean, this is as a definition. Requirement now surgical operation for suspected or confirmed patient. Requirement for operation room and staff PPE. Arrange the patient in a negative pressure operating room. So the operating room should be negative pressure. Verify the temperature, humidity, and air pressure in the operation room. Prepare all required items for operation and use disposable surgical item if possible. All surgical personnel, including surgeons, anesthesiologists, hand washing nurse, and charge nurse in operating room should put on their PPE in the buffer room before entering the operating room. Put on double cap, medical protective mask N95, medical goggles, medical protective clothing, boot covers, boot covers, latex gloves, and powered air purifying respirator. The surgeon and the hand washing nurse should wear disposable sterile operating cloth and sterile gloves in addition to their PPE, as mentioned above. Patients should wear disposable cap and disposable surgical mask according to their situation. The charge nurse in the buffer room are responsible for delivering items from the buffer area to the negative pressure operating room. During the operation, the buffer room and the operating room shall be tightly closed, and the operation must be carried out only if the operation room is under negative pressure. Irrelevant personnel shall be excluded from entering the operating room. Surgical operation for suspected or confirmed patient. Procedure for final disinfection. Medical waste shall be disposed as COVID-19 related medical waste. Reusable medical device should be disinfected according to disinfection which explained earlier. Procedure for SARS-CoV related reusable medical device. Medical fabric shall be disinfected and disposed according, it's already explained in the previous episode, to disinfection procedure for SARS-CoV related infection fabric. Surface of objective instrument and device include device table, operating bed, visibly blood and bodily fluid pollutant shall be completely removed before disinfection, handled in accordance with disposal procedure of blood and bodily fluid already explained. All surface shall be wiped with disinfectant containing 1000 mg per liter active chlorine and allowed sit for 30 minutes with disinfectant. Floor and wall. Visibly blood and bodily fluid pollutant should be completely removed before disinfection, handled according with the disposable procedure of blood and bodily fluid already explained in the previous episode. All surface shall be wiped with disinfectant containing 1000 mg per liter active chlorine, allowed for 30 minutes with disinfectant. Indoor air. There, turn off fan filter unity FFU. Disinfect the air by irradiation by ultraviolet lamp for at least 1 hour. Turn up the FFU to purify the air automatically for at least 2 hours. Procedure for handling bodies of deceased, suspected, or confirmed patient. Staff PPE. The staff must make sure they are fully protected by wearing work clothes, disposable surgical cap, disposable gloves, and thick rubber gloves with long sleeve, medical disposable protective cloth, medical protective mask, N95 or powered air purifying respirator, PPARS, protective face shield, work shoes or rubber boots, waterproof boot covers, water aprons or waterproof isolation gowns, corpse care. Fill all opening or wound the patient may have, such as mouth, nose, ear, anus, and tracheotomy openings by using cotton ball or gauze dipping in 3000 to 5000 milligram per liter chlorine containing disinfectant or zero point 0.5 peroxyacetic acid. Wrapping. Wrap the corpse with double layer cloth sheet soaked with disinfectant. The back into the double layer sealed leak proof corpse wrapping sheets soaked with chlorine containing disinfectant. The body shall be transferred by the staff in the isolation ward of the hospital via the contaminated area to the special elevator out of the ward and then directly transport to specified location for cremation by a special vehicle as soon as possible. Final disinfection. Perform final disinfection of the ward and the elevator. Last thing we will talk about digital support of epidemic prevention and control. It reduces the risk of cross-infection when patients seek medical care using the digital support. Guide the public to get access to non-emergency services such as chronic disease treatment online so as to decrease the number of visitors in healthcare facilities. Doing so minimize the risk of cross-infection. Patients who must visit healthcare facilities should make an appointment through other means, including internet portals, which provide necessary guidance in transportation, parking, arrival time, protective measure, triage information, indoor navigation, etc. Collect comprehensive information online by patient in advance to improve the efficiency of diagnosis and treatment and limit the duration of patient visit. Encourage patients to take full advantage of digital self-service device to avoid contact with others so as to lower the risk of cross-infection. Digital support also lower work intensity and infection risk of medical personnel. Collect shared knowledge and experience of experts through remote consultation and multidisciplinary team MDT to over the optimal therapies for difficult and complicated case. Take mobile and remote round to lower unnecessary exposure risk and work intensity of medical personnel while saving protective supplies. Access the patient's latest health condition electronically through health QR code. Not everyone is required to obtain a green code through the health QR system to travel around the city and online epidemiological questionnaire in advance to provide triage guidance to the patient, especially those with fever or suspected cases, while effectively preventing the risk of infection. Electronic healthcare record patient in fever clinic and the CT image system for COVID-19 can help reduce the work intensity quickly and identify high suspected cases and avoid missed diagnosis. Last but not least, rapid response to emergency need for COVID contaminant. Basic digital resource required by cloud-based hospital system allow for immediate usage of information system needed for emergency response to epidemic, such as the digital system equipped for newly established fever clinic, fever observational room, and isolation ward. Utilize the hospital information system used on the internet infrastructure frame to conduct online training for healthcare worker and one-click development system and to facilitate the operation and support in general to perform remote monitoring and new function update for medical care. And I'm done by this part. And the next part, we will start part two from the book. The title will be the part of the part two, diagnosis and treatment. And in the first episode, we'll talk about personalized, collaborative, and multidisciplinary management. Then we'll talk also in the same episode about etiology and inflammation indicators. Thank you very much. Please share it with people as much as you can. And please, if you have any comment, please send it. Please, especially I am a clinical pharmacist. A lot of things is not my area of specialty, so we need to learn from each other. Thank you very much and have a nice day. See you next episode.